Welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dr. Eden Brown, the clinical director at MediTelecare. How are you today?
I'm well. How are you today?
I'm doing excellent. I'm excited for us to chat. We are in the new studio. The microphone works. It's going to be a good day.
It is going to be a good day. Your new studio looks fantastic.
Thank you. Yeah, I'm excited for it. I think I need to get better looking with how good the lighting is in here is. Was like I came in here and I'm like, wow, this is like really bright. But I digress. Super excited to chat with you today. Let's dive right into it. Tell us a little bit about your background and your role.
Absolutely. So I'm a licensed clinical psychologist, and I specialize in working with trauma and in working with health and medical issues. And so that's part of how I segued into working at MediTelecare with our nursing home resident population.
And you've been practicing for about 12 years now?
Right?
For about 12
longer
years?
than that. I started at the VA hospital in Washington, D.C. with a background in combat trauma, and then I was in private practice for a long time, and now I've been with MediTelecare for over 5 years.
Wow, and they're lucky to have you.
Well, I'm lucky to have them as well.
Well, for the audience, our audience should be pretty well aware of MediTelecare. We've had members of your team on a couple times. We've had Ed on. I believe we've had a couple people from MediTelecare, which has been great. And then I always run into people from the company at conferences. But for today's conversation, we're going to talk a little bit about the challenges that COVID brought over the last 2 years. And then we're going to dive into a little bit on telehealth as it relates to mental health. So first thing I want to kind of bring up here today with you was, what were some of the challenges that older adults faced during the COVID pandemic?
The impacts were really profound, and I think if you don't have friends or family who are in a facility, or you don't work with that population, that there's kind of been an underestimation of the impact. This population in particular was affected so deeply. In a given year during flu season, residents might have been quarantined for 1 or 2 weeks, and those 1 or 2 weeks were really stressful for them. During this, 2+ years of COVID, they have gone through months of quarantine, and that means not leaving their rooms, no communal meals, no family visits, no activities, no going outside. And when you start to kind of think about the limitations and the impact, it just plays out in kind of every aspect of their lives.
And I guess how did these challenges affect physical and mental health of the residents of some of these older patients?
Absolutely. So physically, if you think about, again, these are often individuals who are limited in terms of what they can do physically. Perhaps they're there for skilled nursing, that they're just going to be there for rehab, and then the goal is to return home. But when you are then confined to your room, the simple act of being able to walk in a hallway, or go to the PT area and work with therapy, that those things were so limited, and PT and OT did an amazing job, and they would do as what they could kind of bedside, but physically you would see this really kind of painful decline for people, because they simply could not engage in what were normal activities for them prior to COVID. And then on the kind of emotional mental health side, we saw a really significant increase in depression, anxiety, particularly at the beginning of the COVID epidemic, where there was so much unknown, there was so much fear. Again, kind of a most vulnerable population, pre-vaccination. There really was fear every time someone came into their room. Does this person have COVID? Am I going to get infected? And then just the isolation and disconnection really increased depression. And and for those residents who have cognitive challenges to begin with, disruption to their normal routine, and again, kind of disconnection from friends and family, really it would increase confusion and kind of disorientation. If you have a resident who has some level of dementia and his wife, the routine was that she came for lunch every day, and then you have 3 months where he can't see her at all, you start to kind of think about the impact that that has on, again, emotionally, cognitively, and just that, am I going to see her again? What's happening? Where is she? And when you can't form memories, when you can't store new memories, all of that's even more unsettling and confusing.
Now, we all know that there's a lot of potential benefits of relying on telehealth services when it comes to communicating with older residents. Can you talk us through some of the drawbacks? And this is an interesting question, right? Because we always talk about the pros of everything, but there's always some cons to it, right? And that's
Of
totally
course.
fine. That's how we continue to improve it.
Of course, and that's the only way to
Yeah,
kind
would
of,
love to hear your
right,
thoughts.
to solve some of those issues. The first obvious one is that not everyone has access to the technology. As is almost always the case, it's those individuals who have, you know less in terms of means, that have less access to kind of everything. And so for our residents who already had smartphones or tablets or computers, they were more comfortable with the technology, more able to engage. For those that don't have those resources, those need to be supplied to them. One of the things that we do at MediTelecare is we never our residents never have to navigate the technology on their own. So there's either a CSS who works for our company who helps them with the technology side, or there's a staff person at that facility. Because certainly for someone who has, visual impairments or hearing impairments, asking them to be able to then navigate, technology and set things up, and when there are, internet issues, which unfortunately just happen, that we never want that to be an additional stressor for them. So for older adults, again, who may still be in their home but don't have access to internet, don't have access to technology, those are challenges. And with this population, it's definitely harder on a smartphone. Just that smaller image. If you already are having, kind of visual impairment, a smaller screen is not ideal. So those are some of the challenges that have been there. Um, and then there's the obvious of making sure that there is good quality speaker. Do they need headphones so that they can really have additional access? If does there need to be some closed captioning there for those that really are, hearing impaired? Um,
Yeah, it's interesting too because there's definitely a lot of other. I guess there's some intriguing drawbacks there that other areas of telehealth would never see. Right, you're dealing with older adult residents. The caption piece, maybe they don't see well, so maybe there's a bigger font. Maybe they don't hear as well. So like you were saying with the speakers, the volume needs to be louder. So it's interesting how we look at the different age groups that would be using telehealth and how the drawbacks differ based on that age. So it's very interesting. Now, my question to you, Dr. Brown, as we kind of wrap up here, is what does the future of virtual telehealth services look like? And then I have a part two to that. In your opinion, do you foresee higher adoption of virtual telehealth services moving forward?
Absolutely, and I will happily address both of those. I think the future of telehealth services looks like an evolution of what's been happening now. So I think particularly as high speed internet rolls out into kind of greater parts of the country, because there's the rural populations nationwide are incredibly underserved, and so that becomes an issue. So I think as high-speed internet rolls out, that's going to give greater access and greater access without some of the interfering factors that still currently, happen in more rural areas. I think virtual reality is going to be an kind of an increasing player in this. There's some really interesting research, and we're about to kind of dip our toe into using virtual reality with this population. There's some really interesting potential with individuals with cognitive impairment, and really working to kind of include that as an additional part of treatment and support for our facilities. Um, and then again, as the cost of tablets, as the cost of those things decreases, it allows more access to more individuals. I will say, as a kind of two little quick asides, one of the things that I would joke, but it's true, that throughout the pandemic, this was the only unmasked face that my residents saw. Everybody in their world was in PPE. And so the ability to actually see one another face to face, even on a screen, kind of in the worst of the pandemic in particular, was really normalizing for them. To see somebody's nose and mouth, that, and I think we've all become more aware of that as we've had to mask up. So that's been kind of an interesting piece. And then I absolutely love when my residents will say to me, my grandson wanted to Zoom with me, and I told him, I know how to do that. I do that with my doctor. So that it kind of increases their ability to use this technology beyond the telehealth setting, that they become comfortable being able to connect with friends and family in this way, and to feel more connected, even though they may be physically isolated.
Yeah, it's interesting. It's but I'll even see people sometimes take video calls while still wearing a mask when there's no one. They're like in their
Mhm.
office, door closed. So it's nice that you didn't do that. Because like I remember I was on a Delta flight recently. This isn't it kind of is a shot at Delta maybe. But basically, they're showing us the training video, and all of their training videos are filmed with people with masks, but they're individual, like they're not even near people, and it's you forget because we had to wear masks for so long all the time. It's really weird watching a video with someone and not being able to, like, especially if you're hard of hearing, reading lips is
Absolutely.
so important. Yeah, it's weird. And it was normal. It was we went for a while with it all the time. Now, I'm not knocking masks or anything like that, but when it comes to the when we're doing these video communications, like that's the time that we don't need the
Absolutely.
mask. So it's important to take the approach that you did, brighten up their day, show them that people have a
Yes, right.
mouth,
Have a nose and
and
mouth.
yeah.
And particularly at the beginning of the pandemic, there would be, for some, again, those that had some, some level of cognitive impairment, some confusion, like, can I take my mask down with you? Like, yes, right. This is safe communication. Or when, somebody would be COVID positive, like, well, I don't want to get you sick. Like, you can't, right? This is a safe way for you to talk to me. You're not going to get me sick. I'm right. You're on a screen, I'm on a screen, it's okay. And just kind of having that normalizing, so that people can make decisions, about, okay, yes, I can lower my mask. This is safe communication. No, now I need to put it back up. But it's been a bizarre couple of years.
It would have been funny for me at the time to just shave where the mask was and then wear the mask and see. I could have
Everybody,
fooled
nobody would have
everyone, Dr. Brown.
known.
It would have looked ridiculous when I do the Zoom calls, but it
It
would have
would,
fooled everyone.
absolutely.
Yeah. Um, well, Dr. Brown, I want to thank you so much for coming on the podcast once again and sharing your thoughts on everything. And hopefully we can have you
I would
come back
happily
on
do so.
again. And
Thank you so much.
thank
I
you so
enjoyed
much.
talking with you.